Welcome back to Spit It Out with Meg. I'm your host, Meg. I have a very special guest today. His name is Kevin. I'd like you to introduce yourself, Kevin. Welcome on.
My name is Kevin. As she just said, I am a registered dental hygienist of over 2.5 years now, coming up on 3 soon. So I'm very happy to be on this podcast and get to know you all and just answer some questions.
Kevin, how did you start your journey into healthcare and what led you to choose dental hygiene?
So I think with healthcare has always been a part of my childhood. I think a lot of my cousins played a big part in it. I have a lot of cousins who are nurses, nurse practitioners, physical therapists, actually, as well. So healthcare has always been around us. So I think growing up, I always knew I wanted to be in healthcare. Didn't know exactly what it was. If you guys watch my TikToks, originally it was PT. PT didn't work out. So what I did is I did my research on different healthcare jobs. And I literally just went on Google and I searched up what is the best healthcare job that is high pay and not that much schooling. And surprisingly, dental hygiene I think it was number 1 or 2 on a list. And it was next to ultrasound tech and I think x-ray tech. So out of those 3 choices that I had, I was like, let me get into dentistry. I don't have anybody in my family that is in dental. And so I did my research on dental hygiene. And I was like, let me start my journey. I started that and kind of fell in love with dentistry at that point.
You mentioned you were going to do physical therapy. What changed your mind? What was the decision that made you kind of pivot?
As dumb as it sounds, the schooling. I think when growing up, PT, you actually did not need to become a doctor. So you didn't need your doctorates. And now you do. So when I went to my counselor about PT, I was so excited, I was like, oh yeah, I'm gonna become a PT. And she basically mapped out a path that I had to take to become a PT. And I guess recently that's when they changed the entire curriculum. And you needing more than just your bachelor's, you need your master's and then your doctorate. But when she mapped that all out, I was like, oh, how long would this take? And I'm listening and she says, it's about 8 to 10 years of school. And I was like, oh, shoot. I'm what? I think I was at 19 at the time. I don't want to graduate when I'm like 28, 30 years old. Like that felt really old to me. Not to say 30 is old to anybody, but it just felt really long. And that's not what I wanted.
I kind of did the same thing. I was like,
that's so funny.
So where can I go to school and get paid similar to a nurse, but I don't have to do 12-hour shifts, work weekends, or have to work holidays? And I was like, this one.
That's so fun. Actually, I remember I posted a video on TikTok and it was actually about the PT thing, switching from PT to dental hygiene. And surprisingly, I got like multiple comments about how people switched from PT to dental hygiene. And I was like,
what?
Yeah, no, I swear. Yeah, I forgot which video it is, but it's down there in the archives. But I was just like, what the heck? That's so weird. Like people transferred from PT to dental hygiene. And I don't know, it was weird. Coincidence.
Well, it's also interesting that you mentioned that because I don't know if this is true. This is all alleged, but I've heard from like an old roommate I used to live with. She was going into PT. So I was kind of chatting to them about wages with physical therapy. And the biggest concern with them was that you have to get a doctorate degree, but the wages haven't increased because insurance reimbursement hasn't increased. That's everywhere. But I just thought that was kind of wild because I asked, like, how much do you get compensated? And it wasn't that much different than kind of our careers. That's a lot more schooling and it's so different. But I guess that's just where it's at. And
I think that is true. Like I said, one of my cousins, he's about to graduate from PT. He was telling me how they will not be making that much money, especially the first couple years. I want to say he said less than like 75,000 or something like that along the range. It was not a good number. And I was like, oh my God, like you're in debt. And the first 2 years, like you're really not making as much as you should be.
Did you go through a community college or a bachelor's degree hygiene program?
Community.
What was your experience going through that program and why did you choose that program over a bachelor's degree program?
First of all, I think any dental hygiene program is super competitive, super hard. That was probably my hardest 2 years of my life, just going through that. I don't think whether it would have changed if I went community or bachelor's, but the reason I did go to community was because it was cheaper. And when I tell you like my tuition compared to someone else's, especially whether it was another community college or if it was a bachelor's, I got lucky and the community college I went to was actually one of the cheapest dental
Oh,
hygiene programs that I've found. And I don't
wow.
even know if there's any other hygiene program that like compares to the price.
Oh,
I don't remember the exact price, but it was for sure like okay. Like right now,
that's
currently, like
awesome.
I have zero debt like from school. So that was the biggest benefit from going to community
Wow.
for me
That's
personally.
really great. That's awesome. I love that.
As long as you do research, you will find what you will need to find.
Exactly. Do you ever see yourself getting a bachelor's in anything, or are you pretty content with your associates?
I actually think about this a lot. And I even talked to my girlfriend about it, but I do think about it a lot. Like, I would love to go back to school to get my bachelor's just to further my education. But I did think about going down the path of RDH.
I was just going to ask about that. That's so cool.
That was something that is just in the back of my mind, you know? And
That's so
I do want to
cool.
pursue it. And then I'm like, I'm kind of content where I'm at, but I do want to pursue it. I mean,
Yeah.
you just have more autonomy and all of that. I think it's just that pathway is cool.
Can you let me and my audience know what technically is an RDHAP and what can you do? Because I don't have that in my state, and I know most states don't. I'm pretty sure
Oh
it's only
wow. Yeah.
California. Is it only California? I don't
I
know.
know, I know it's for sure California. I don't know if any other states have it, but
Okay,
basically RDHP is it's registered dental hygienist of alternative practice.
Mhm.
And basically what that means is that I want to say it's a 6 months to 1 year extra schooling, and you're basically learning a lot more of the business side
Mm.
because once you get your license, what you can do is create a brick and mortar. You can actually make your own brick and mortar practice, and it would just be you. You're just doing cleanings in the office, but it has to be in an underserved area. You can't just place it wherever you want. I think that's kind
Oh.
of the downside. But yeah, basically you're your own clinician,
Mhm.
but you will be in communication with dentists and you will send them out and refer them out for exams and all that. But it's a big price jump salary wise as well. Every cleaning you do, you will get that money reimbursed
Mhm.
by insurance, or if you want to just be like cash, then you could do that as well. But definitely, I think your pay will increase by like double and even almost like times three.
Well, wow. I wish more states
Oh
had
no,
that, you know. I
I didn't know
think
that. I didn't
yeah.
know like California was maybe only the only one. I don't know.
Let me look it up. I'm gonna
Yeah,
Google that.
look it up.
I'm
Look it
very
up.
curious
Google it. I'm
because
curious now.
I know that Colorado you can open your own practice too, but
Oh,
okay.
nice.
But I don't know if it's the same thing. So let me see.
Yeah, yeah. Search that.
RDHAP states. According to Google AI, RDHAP is a California specific license for a registered dental hygienist in alternative practice.
Oh
And
wow.
it expands everything of what you said.
Yeah.
And then it says in other states and their models. Colorado allows hygienists to own practices with no supervision required. Maine allows independent practice dental hygienists to work without supervision. Oregon is similar, just with the supervising dentists. And
Oh
then Kansas, they kind of like have an extended care permit, but that's kind of it, it looks like.
wow, that's crazy.
So,
So California is king, I guess, in being able to do that. I don't know.
yeah, there's a
Well, it
lot of
seems like.
things I'm a little jealous about. I think that's great. So, you mentioned having an athletic background. What kind of sports were you
Yes.
involved in?
So growing up, the only sport I was involved in and will forever be my first love is basketball. Basketball has just always been the sport I truly radiated with. I played basketball from elementary all the way until the start of college. Because after I started college, that's when I was like, I really need to lock in and do my dental stuff. Currently, though, I do play pickleball.
Ooh.
So pickleball right now currently is my like sport that I am like fully invested in.
Oh my
And
gosh.
yeah, I would like to go pro in pickleball. It would be
No way. That's
here's the thing,
sick.
like if I can become pro in pickleball, like I would
Yeah.
still do dental hygiene,
Yeah.
but I would be like a part-time dental hygienist, like
Just for
full-time
fun.
pickleball pro.
It's like for the
Just for fun.
PR, you know, just to meet
Yeah,
people and be like, "Hey, come
exactly.
watch
Just have
me."
connections, you know. So
I didn't know you were into that. Like, do you have to do something certain to become pro? Like, how does that even work?
yeah, here's the thing. So becoming a pickleball pro, I'm not gonna say it's easy,
Mhm.
but it's easier to become a pickleball pro than like for me to go to the NBA for basketball. So pickleball pro, what you have to do is you're playing in tournaments, and then there's a thing called Duper, DUPR. That Duper is a rating system.
Mhm.
And so technically it goes from 2.0 to 3.0, 4.0, 5.0, 6.0. To be considered a pro, technically, you are over the 5.0 Duper rating system.
Oh.
And so when you're at a 5.0, what you can do is when you're doing tournaments, they have official tournaments called the PPA, which is Professional Pickleball Association, pro qualifiers. And so you
Ooh.
play in that tournament and then you make your name for yourself. If you win it, great. You know, if you win it, you will go straight into like what they call the main draw, and you
Yeah.
play against the actual pros right now. I mean, it sounds simple, but of course you still have to be like really, really good.
So you're really, really good, or what?
I mean, I would say like, because like I said, I'm fully invested in this. Like I actually wake up 5:30 in the morning to
My
go
gosh.
drill, like go practice pickleball. I don't care if it's cold. If it's raining, yeah, I don't go. But if it's cold, I don't care. I will wake up, go and do my drilling, my practice every day, literally almost
Hey,
every day.
good
And
for
so I
you,
think
man.
I think I'm actually in terms of like pickleball talent, I think I'm I would say I'm up there. Like I'm decent, you know.
I think that's really cool. Like, to be
I think,
honest, I'd love to see you and my mom play a match. She thinks
oh
she's
my
pretty
god,
good.
that'd be great.
She's pretty good, I guess. I get scared of her on the court, dude. She's like, she has a
Wait, have
club.
you played?
Yes, I have played,
Oh,
but
good. Yeah.
yeah,
Sure.
they have a whole like gym just for pickleball. And I think that's totally normalized by now. Dude, she's locked in. You like
There you go.
it's
That's how it is.
it's amazing.
Really gotta. I think pickleball is all about reflexes. You know.
Well,
So,
how do you think your athlete's mindset carries over on how you work, your dedication, your commitment, all of that?
but if you do come from sports, I think having an athletic mindset is actually super important and super helpful at the end of the day. Like I said, when I'm fully invested in a sport, I'm locked in, right? You know, I'm like super motivated to be the best at that sport. I will practice, I will do whatever it takes, right, to be the best at that sport. So when I carry that over to like dental hygiene, same thing. I would like to be one of the best dental hygienists out there in terms of like scaling or just in general. But like, of course, scaling, like that was my main thing. Of course, during school, I got golden scaler because I kind of worked for it, right?
Of course, in school
And,
you
you know,
got the
I had
golden
to work for it though,
scaler.
right?
Of course, Kevin got it.
So
Oh my gosh,
I worked hard for it,
that's
but
awesome.
I think when you carry that mindset over, you can truly, if you really want to be the best at something, then there's no excuse, right? You'll practice for it. And I think
Hmm.
having that strong mental capability coming from sports, there's a lot of pressure. Like during basketball games, when we're playing on away games, we're playing against other teams at their house, at their school. They have a bunch of student sections screaming, "You suck, you suck." And so being able to kind of block out all that negativity, think about it, carry it over to dental hygiene,
Hmm.
carry it over to social media, right?
Yes,
Both of us
yes,
know social media is it's a good place, but also a very evil place at the same time.
yeah.
People are negative.
Hmm.
And especially being an influencer, I think you have to really learn how to block out that negativity. So
It's
I think
true. On the same note, so in school, what were your study tactics that helped you succeed in all aspects?
So I would say when it comes to scaling, let's talk about scaling since we're already on the topic. But scaling would I really worked on my fulcrum, and let's say we're sitting in class, I'll grab a pencil, right? And I would hold my fulcrum the entire class.
Yeah.
I'm just holding it, and let's say we're listening to the lecture, I would hold it and I'm on my table and I'm just going like this, working on strokes. I'm thinking about like, oh yeah, like if a calculus was right here, let me rotate it. Let me not rotate it. So
Yeah.
like little dumb things like that really, I think that truly, really helped.
Hmm.
And just practicing, we had our typodonts, of course. So practice on that. As for studying wise, I always tell people who DM me like, oh, how do you study in hygiene school? That I think it's very important to make study groups. There's always going to be different study groups. I think that's the thing. There's different people that you hang out with, and there's different people that you study with. I think it's good to be a part of each study group because you never know what someone else can really teach you, and then you can really teach them. So I think having study groups and being able to study with different people is what truly made me excel in the program.
Oh, yeah, absolutely. I found that when I really knew something, I could teach someone it. Like, I could
Exactly.
just sit down and be like, let me just tell you what's going to be on our test.
Exactly.
Let me teach you something. I don't know if you've ever had those moments, but it was kind of like, it always felt good. Hygiene can be hard on the body. How do you take care of yourself and stay healthy long term?
I think listening to your body is super important. If you feel an ache or something like that, don't just like brush it away. Kind of take care of it. Do your research. Why do you feel this ache? What part do you feel this ache? I have an amazing chiro that I go to once a month. And even if I'm not feeling pain, I still go because I want to take care of my body preventative wise. And she's amazing in a sense where we talk about what hurts during that exact moment or what doesn't hurt and what feels good right now, what you think might feel bad later on in the future. It's not just adjustments, right? She does a lot more than just the cracking and all that. You know, she does the cupping and the muscle scraping, and I think that's truly helps so much. And going once a month really, I feel good. That's the thing. And she's not just working on this whole body; she's working on like my hands, right? These are our money
Oh,
makers.
yeah.
Yeah, we
I
gotta take care
know.
of these. We gotta really take care of these. What else do I do? Oh, you know what? Go on vacations. Everybody who's
There
listening
you
to this,
go.
go on a vacation.
This is your sign
This
right
is your sign
now.
right now. If you're listening to this podcast, go on a vacation.
Get out.
It doesn't matter where you're going, just go somewhere. Take a break from work. No,
Hmm.
I love my job. Trust me, but you got to take a vacation. If you get PTO, great. Go use your PTO. If you don't get PTO, still go. Take time off. Really just relax. That's
Yeah.
it.
Oh, yeah. Do you get massages at your chiro?
Yeah. I mean,
Okay.
not like a deep tissue massage. She has a contraption where you're laying down
Yeah.
and she'll strap you to the
Shut
yeah, I
up.
know it sounds scary, right? But she'll strap you, like strap your ankles, and then you're holding on to like these bars, and then it pulls your back like this. I know,
Get
pretty crazy.
out.
Feels good
I need
though.
to look that up. I go to a physical therapist. Well, I was going to a physical therapist because I have currently, of course, right now, a knot right back here.
Yeah.
And it always flares up when I'm not doing my PT that he told me to
See,
do. And I'm just
see,
like, I need to be a good patient. And I haven't. And it's just one of those reminders that like I also have to do what I'm told to take care of
right?
myself because
Proactiveness.
I know, and that's all we do all day is tell people how to brush and floss and take care of
Exactly.
themselves and everything. And I'm just like,
Right, right.
provider's guilt.
No, no, for real. Like, I mean, at the end of the day, I tell patients this too. Like, we're all human. You
Yeah.
know, emotions and laziness and all this stuff we do. That's what makes us human. I think I mean, that's the beauty in being a human, right? But I think, yeah, you're right. Like, we do have to listen and kind of, just listen to the body. Just do as you're told. You know, don't make it harder than it is.
You are known for your before and after scaling and root planing photos. What do you
Yeah.
love about showing these transformations?
I think showing those before and afters really give a good visual to people, whether you're a patient, whether you're a clinician. I think being able to give that visual before and after is super helpful. That's just my personal opinion, but being able to show anybody how a tissue and your teeth can look before a deep clean versus after is, I think it's like very powerful. You have super inflamed tissue bleeding, and then you switch it over, and after they come back, everything's like nice and pink, and you could tell that the tissue is just so much tighter and happier. And I think just being able to show that alone just proves how important dental hygiene is. You know, not just up here, but like the entire body. So
I hope patients have seen your videos and hope that they are encouraged to go to the hygienist because of you. I think that's really cool. I love those pictures. How do you think hygienists and dentists can work better together for patient care?
I think the simple answer is just trust and communication. Like, I have my dentist that I work with. She's amazing. She literally like 100% trusts me in my judgment, which means that she respects my knowledge and what I know and what she knows. Just like example today, came from work. So we had a patient together, a new patient. Basically, we were talking, Kevin, what kind of cleaning? So we usually get together, talk about it, communicate. Communication is key. And so she says, Kevin, what do you think? And I'm thinking like, I was like, I see like bone loss here, a little sub here. I was like, yeah, I think we should do like SRPs. And she was like, okay. She was like, I agree. No questions asked. She just said, I agree. And I think having someone like just agree with you just like that, like it just shows like how much trust you have in that provider. If she said something to me that maybe I don't agree with, then we would talk about it and we'll see both sides. I think being able to see from the dentist side, being able to see from the hygienist side, like I think that's super important.
I agree. If you could change one thing about hygiene education or the profession, what would it be?
Dental hygiene, I think we deserve a little bit more autonomy in our field.
I
Like
agree.
honestly, like being not being able to diagnose cleanings is a little crazy to me since that's what we know and what we learned. So I think that's a little crazy. But I think another thing is, and it seems like it's a common thing, that dental hygiene programs are kind of negative. The professors that teach, I think they make it hard. I can see where they're coming from. They're making it hard for a reason, but I think at the same time, you don't really need to like push that narrative of negativity. Especially, I think the first year of dental hygiene program, that was probably the toughest because you're just your first year. When you're in your second year, your senior year, like I think it's a little more chill. But in the first year, like they're really, really, really hard on you. They scare you. I think they use a lot of scare tactics. They'll be like, yeah, if you can't find this patient or if you can't find this patient, like you're gonna get kicked out. If you don't like this scraping noise, you're gonna get kicked out. Like what? You know? So I think that's another thing I would change.
Oh, yeah, I think autonomy is number one on my list. Other than insurance reimbursement, that could be better for
Oh God,
everybody.
yeah.
That's
Yeah,
like
for sure.
that's like everybody for real. But in just dental hygiene, yeah, I definitely wish I could prescribe Prevident. Like,
Oh my God, I
why
know.
can't I do that? Like,
Like
I don't understand.
it's
I don't understand. Just any preventative services, like that should be like maybe, okay, maybe in a perfect world, yeah, everyone gets this RDHAP in nationally, and then that'd be so cool because then like you can do more stuff. You know what I mean?
right.
Like,
Like even
ah.
what do you call it? Doing local anesthesia, like being
Oh
able
yeah.
to do local anesthesia without like a dentist. Well, when you get your RDHAP, you don't need a dentist on site.
Wait, you don't wait. Okay,
If you
I
get
know
your
this is
RDHAP,
so in Idaho, I can do local anesthetic if the dentist is out off the practice. Can you do that in California? What?
we
Why? What the
we
heck?
need them. They don't need to watch us or anything, but they need
No.
to be like on site somewhere. They could
Dang
be in
it.
the restroom. They could be in the restroom.
Yeah. I don't get why that's also like not nationally a
I don't
thing
know.
either. Like Shelby RDH was telling me how in New York she can do all local anesthetic except like blocks or something. And I was
What? No
like,
way.
but yeah, there's some states like in Texas they just made it legal for hygienists to do infiltrations, which is great. But I'm just
Yeah,
like,
but
guys,
they're behind,
who
but that's crazy. Yeah.
who has time to wait for a dentist to do anything of that? I literally would like claw my eyes out. I'd be like, "Hi, I need an IA 20
Hurry
minutes
up.
ago."
Yeah.
Like,
IA,
no.
IA.
What a
I need a
waste of
nerve block,
time.
please.
I don't
No.
get it. I think we have the education. It's not like we didn't take like how many years of head and neck anatomy? I don't even know. A lot
I
of
don't
it.
a lot.
And anyways, I could talk about that for an hour.
That's
Rant
a
for
whole
another
that's a
day.
whole that's a whole thing. Like
What's it like being a male hygienist in a mostly female field? And what advice would you give to others considering it?
I think at first, knowing that the majority is women, I think I was a little intimidated at first. And I was like, do I really belong in this dental hygiene field? Right. And I think getting over that hump was probably the hardest thing. Just being intimidated, like, oh man, like it's just gonna be just pure women. Not to say you guys are scary, but it's like, hey, like most patients are going to expect a girl hygienist.
Mm-hmm.
And when I think graduating and getting into like private practice and all that, a lot of new patients, when they saw me, they were like, "Oh, hey, doctor," and I was like, "Whoa, whoa!" Like, "Oh, I'm not your doctor." Yeah, whoa! Like, no offense to doctors or dentists, but I was like, "Whoa, I'm not your doctor." I was like, oh, "Nice to meet you." Like, I'm Kevin, your hygienist, and they're like, "What? Hygienist?" They're like, "No way!" And then they're like, "All the hygienists I've seen in my entire life," and mind you, this patient's like what, 80 years old. All of my hygienists have been, girls or women. And I was like, "Oh shoot!" I was like, "Well, nice to be your first hygienist." And they're like, "Yeah, don't be rough on me, please." So I think that's another thing is when they see a guy as a hygienist, they automatically think, oh yeah, this guy is probably stronger than most. Then he's probably going to be more rough. I don't know. I think that's probably the most. That's how I felt like when I first started. Now I feel pretty good. Like I feel special actually. You know, my advice is don't let that scare you. Even you're gonna feel intimidated, scared. Let your body, your mind go through that feeling. But I promise you, it's gonna be okay. Everything's gonna be okay. You just gotta keep going. If being a hygienist is your dream, chase it. Don't let anybody stop you. The only person that will stop you is yourself. I think, yeah, that's my advice to the guys or anybody getting into dental hygiene. Just push it, push forward.
Yeah, I love that. What kind of impact do you hope to make in dentistry and beyond?
My main goal in dentistry was to really push and be an advocate on how important your oral health is with your overall health. And I still think that there's still that barrier, you know? There's still that barrier that people don't think medical and dental are or should be the same like category. People always think it's separate, but I mean the studies say differently. There's so many diseases that connect with your oral health. And I think being able to push that narrative and really let people know how important it is, I think that's my number one goal. And my second goal would be to really take that fear out of people who are nervous to go to the dentist. I've actually at my office, every time I get a new patient, and if they are dental anxiety and they hate the dentist, everybody always says, go to Kevin.
Aw, that's
Talk
the
to Kevin.
best.
Go to Kevin, talk to Kevin.
Aw,
We'll have Kevin as your hygienist. They'll automatically put that patient with me.
yeah.
You know, I like to, I'm talkative. I think I'm a cool, like I said, I'm a chill, cool guy. I think I like to break that barrier that you shouldn't be scared. I get it. You know, maybe you had a traumatic experience when you're younger, or maybe you just hear so many bad things about the dentist or whatever it is. I think my goal is just to take that fear away and truly make you feel comfortable when you come to a dental office, make you really want to come to a dental office and just better yourself orally and overall. I think I already started making that impact in my patient base. I have a lot of patients who they say, I come to the dentist because of you.
Aw,
They're like, I've never wanted to come to the dentist, but now that I have you as a hygienist, I want to come to the dentist. I think, I don't know, those are my two goals for sure.
that's really cool. I love that feeling when you're just like, man, I really hope this person like
Yeah.
sticks around. It's like,
I know, yeah. Oh, are you going to come back for your recare?
I know. I love that. I just had a patient too a couple days ago who, like, everyone told me in the office, they're like, oh, he's really tough. Like, he might push back on everything. And I was like, try me,
Got it.
whatever. So he
I'm
comes
Meg.
in and I just kind of like, I don't talk a lot. I can sense the vibe. I'm just like, okay, I just need to chill, like, keep it quiet. And I finish and I'm like, oh, how'd it go? And he just goes, you're done? I was like, yeah, honestly, like, not too bad, you know? And he goes, that was like the most painless cleaning I've ever had. And it wasn't that bad. I thought it was going to be different. And I was like, oh,
Right.
no, you're good. And it was just really sweet because, like, at the front desk, he was like, well, I only want to come back if she's here. Okay. And I was just like,
See?
okay. That's just, okay. That's so nice.
Isn't it, I think, and I think that's such a good feeling too.
Yeah.
Like just knowing that that's it. You bridged that gap already.
Mm-hmm.
You literally bridged that gap, and now knowing that they want to come back because you're there,
It's the best.
like that's amazing. You know what? I have a lot of patients who are like,
yeah.
Kevin, if you ever leave, tell me. You know, so I was like, oh shoot, well no, you know, but I think it feels good. It's a good feeling in that heart, you know.
Well, we are just about to wrap up. So, what is next for you, Kevin? And where can my audience follow your journey?
What's next? RDHP? Nah, I'm just kidding. I don't know. Maybe. But yeah, I mean, I'm gonna continue to just advocate for us hygienists, push forward, really make a name for myself. Follow me, my journey. If I get my bachelor's or if I get my RDHAP,
Pickleball Pro.
Pickleball Pro.
Hey, come on.
Follow me on that. If you know, I might go pro, and you know, but if I go pro, I still care about your oral health, you know. So, but yeah, you could follow me on my TikTok. I have a weird username, and there's a
What's your
story behind it.
username?
But
What's your username?
rabbit underscore Lokes, LOKKKS.
So, what is that? I just need to know.
So, rabbit is is like my nickname from basketball.
Okay.
Or in Spanish, they say conejo.
Yeah.
So there's rabbit, conejo, whatever it is, bunny. But
Yeah.
they call me that because I'm able to like jump super high.
Oh my
And so in
gosh.
basketball, like I'm able to get up there, you know, that's what we say. My Instagram one, which I do need to start posting more. That one I believe is just Kevin Lee RDH. So KEVINLY RDH.
I'm going to put Kevin's information in the description box if any of you would like to connect with him. Thank you so much for watching. Thank you for coming on, Kevin. It was really nice to chat with you.
Of course, thank you.
And I will see you in the next one.